Now, Kenya Union of Clinical Officers issued a strike notice and it's supposed to come into action on Sunday midnight. What are some of the factors that you would say are contributing towards the clinical officers taking this stand yet again?
I think we have some long-standing issues that we have been trying to raise since the start of this pandemic, and the matters are actually around the safety and welfare of clinical officers. We started with trainings, which up to now they have never even done 50%. We talked about personal protective equipment, usually known as the PPEs, which also have not actually been provided. We talked about a commensurate health risk allowance because we don't even have a cover and we're having to contribute and to pay for our things. And of course, the issue of contracted staff being used to man isolation centers, and they do not even get an allowance to cater for themselves, and they are paid amicably. So we gave a demand, we gave a strike notice with several demands. One was that they must ensure that all the PPEs that we have at KEMSA are distributed so that we have PPEs right from the dispensary to level 6 hospitals. Number two, we said that all our vulnerable health professionals, and by vulnerable I mean those with pre-existing diseases, those who are aged more than 55 years, and those who are pregnant, to be exempted from duty, because we have seen that all the health professionals that we have actually lost belong to this category. And if we were to exempt them from active duty, then we would be actually be saving them, and we will reduce the number of medics who are dying. It's very unfortunate that we have just lost the other day a clinical officer, 32 years old, from Nandi County. He has accumulated, and I think his case summarizes our plight as health workers. Number one, according to the rational, to the guidelines of rational use of protective equipment, it says that if you are working in a consultation center, then you are supposed to have at least an N95 mask and eye protection in the form of a face shield or goggles. We do not have that in any facility in Kenya, and yet we are making them locally and they're actually available. So it's lack of goodwill. Then they deny you the right PPE. Then when you fall sick, you do not have a medical cover to cater for you. When you die, they do not compensate your family. Then how really are we supposed to, in the case of patriotism, uh, then flatter with suicide, because it's flattering with death actually. You have been exposed to be infected and then nobody cares. So you're actually flattering death. Then we said that the health risk allowance must be increased to at least 30,000. Right now, we have several WhatsApp groups where we are doing harambe for our fallen soldier, Victor Tioni. And we have to raise 2 million because the government cannot be able to pay the bill. And that is why we are saying we will no longer be contributing, we will be getting them from the hospitals ourselves.
This is not the first time clinical officers are issuing strike notices. It's been there before, and you guys have sort of had to go back to work. So where's the disconnect? Is it that the government is not meeting your demands, or is it that they're too slow at meeting your demands? And with this strike notice, are you in any form of conversation with the government?
So I think it has become the norm of the government to treat health sector with contempt. You can imagine from the start of this pandemic, we have never seen the president or the CSs or the governors call the leadership of health workers and ask them what is happening and how can we be able to assist you so that you help our people. That has never happened. Number two, when you give your demands and you try to raise your voice so that you can have a conversation, you find that the government acts uninterested, like they are doing now. We have done so many advisories since March, which have not actually been responded to. We issued our strike notice, the first one in May. We had to suspend after they said they were going to fast track and actually find solution for this issue. Then come August, when we realized that they were not actually doing this, we issued a second strike notice. And then the same process they are doing now, we went there, they told us that they were going to fast track. but actually nothing happened after that. Um, then now, yes, they have called us to the Ministry of Labor, but whatever they are doing is what they have done previously in the two occasions that we have been before the Labor Ministry. And I think what we are saying now is that we are not going to accept to be played because we have been played twice, and uh, there is no way that we can continue with the way we were doing things before, expecting different results. That is why we have said that we are going out for posterity. We must ensure they meet these demands, because if they don't, then we are going to die. If we die, then Kenyans are not going to be saved, because there won't be anybody to help them. And then we want a constitutional health service commission so that it can be there for posterity to solve these grievances and ensure that we do not have these perennial strikes. If you look at the critical sectors in this country, they all have a commission to take care of the welfare of the employees, to ensure that there is uninterrupted delivery of services. Look at Judicial Service Commission, look at Parliamentary Service Commission, look at Teacher Service Commission, look at Police Service Commission. Why is it that health is the one that they want to use for political expediency, for politics of money and control, because that is what it is being used to?
You're saying the Ministry of Labor has called you, but it's the same repetitive stance that they're trying to pull. What does this mean come Sunday midnight, when people go to hospitals beyond midnight on Sunday and on Monday? How will hospitals look like?
So I think what we are saying is that what we are being fed is pure rhetoric, and we are no longer taking rhetoric. We will only respond to PPEs in the lowest facility, from the dispensary to the highest, the level 6. We will only respond to a risk allowance that has been enhanced, to a medical cover that has been availed. That has not happened, and we will not go back unless those demands, because I think those are the baseline demands, before they are addressed. And by that time, if they will not have addressed, then I'm sorry, and I apologize to Kenyans, that we actually have to step out and stop working to ensure that they put priority where they should, because it is not the time to politics. This is the time to ensure that all resources are geared towards solving this pandemic and taking care of the soldiers who are fighting in this pandemic. And I want to warn them, let them go to court if they may. But if they go to court, we will suspend the strike, but we will invoke the Occupational Safety and Health Act. And because the working environment is hazardous and it's a risk to our health, the Act actually allows us to walk out of work, and it says that that does not constitute an offense or a disciplinary action or abscondment of duty. We are very patriotic, by the way. If it was in other countries, people would have just walked out, because the law actually tells us if your working environment is risky, you can walk away. But we decided, because if we walk away, it's our mothers and fathers and brothers and sisters that are going to suffer, that let us try and talk to the government so that they can be able to rectify this situation. But they have shown that they have little interest, and so we have to take the drastic measures to ensure that their priorities are where they should be.
Washira, thank you for making time.
Thanks a lot.
Thank
I
you.
appreciate it.